You are listening to the Cultural Providers Network podcast, a Minnesota Association for Children's Mental Health production, building and sustaining a network of culturally and ethnically diverse voices to promote policies, practices, standards, and research that improve the mental health of children, their families, and communities.
This podcast is brought to you by the Minnesota Department of Health. Greetings, everyone, and welcome back to another installment of the Cultural Providers Network podcast. I'm your host, Brandon Jones, and this podcast is sponsored by MACMA, Minnesota Association for Children's Mental Health. And on today's podcast, we have the smart, the brilliant, the lovely Jade Mills with us today. How are you doing today, Jade?
Doing well. Thank you for having me.
Yeah, thank you for being here. We're going to have a conversation about culture. We're going to have a conversation about therapy. We're going to have a conversation about Minnesota. We might even have a conversation about Missouri, where you're originally from, right?
Yeah.
Can you give us a bit of a background on who you are, where you come from, and even what made you become a therapist?
Absolutely. So like you had mentioned, born and raised in Lee Summit, Missouri, a pretty small town right outside of Kansas City, Missouri. So grew up there my entire life. And I always tell people I kind of snaked my way north throughout my education career. So I went to my undergrad in Des Moines at Drake University and landed in Minnesota for my graduate degree at Winona State. So I had family in La Crosse, Wisconsin that I lived with during my time in Minnesota doing my graduate degree. So that was really nice to be around folks that I knew. And as far as getting into the therapy world, I actually knew from a pretty young age that I wanted to be a therapist. I would say, I think it was around middle school that I kind of solidified, hey, I want to go into this field. I had always been told that I was really good at talking to people and kind of helping people through tough times. So it kind of fell into place for me to go into the field once I got older.
Awesome. And how long have you been doing therapy now?
So I have been a therapist. I graduated in 2018, so about 6 years.
Wow. So a good chunk of that was during the pandemic.
Oh, yeah.
What a great time to start your career is right when, the whole world is saying, hey, I need therapy. Well, we should go talk to somebody. This is crazy. What was that experience like? You're really just kind of getting your teeth sunk into this thing and the pandemic happens. What was that experience like?
I would say it was really difficult because at the time, I primarily worked with teenagers, so about middle school to high school age. And some of them just weren't having it. So it was really hard to figure out how to be creative, to get folks engaged. And also just kind of thinking about the dynamics that were going on in households and making sure folks had safe spaces to be able to do therapy and making sure that, people were safe if they were having a tough time. So I think it just kind of added even more layers of complexity, trying to do telehealth when typically up until that point, it was all in person and you could see people's body languages and their full faces and all of that sort of stuff. So it definitely really changed the game as far as providing services.
Absolutely. Wow. And then, you add the extra layer of culture on the therapy, which is, the main focus for our conversation today. When you initially went into becoming a therapist, going to school, what was your experience like being a BIPOC person? How did you navigate, your school experience as a person of color?
I would say it was actually pretty difficult. Even back in my grade school days, I lived in a predominantly white community. And I was one of about, I would say 5 people of color within advanced classes in high school. So even from early on, I was one of very few. And then even during undergrad, going to a predominantly white institution, that was also difficult. I actually encountered quite a bit of racism in that space. A lot of talk about affirmative action and using that in a way that had a negative connotation, which was really hard. And even in graduate school, just kind of navigating being taught from a primarily Eurocentric model. It didn't really dawn on me until I was fully in my practice of working with people of color that a lot of the tools that we have for therapy are based on white men, and not everything works from that angle. And so just really kind of sparking my interest on how to help figure out how to work better with people of color. But that journey didn't really start until probably after George Floyd's murder.
Okay. Wow. Yeah. And I think for a lot of folks, that journey began right around that time as well. You know, sometimes I hear people, being in the state of Minnesota, we hear people talk about, you know, George Floyd happened in our backyard. And I'm like, no, George Floyd happened in our front yard. Like, we can't avoid what took place here. I mean, we became kind of ground zero for all things social justice. And we've maintained that position since. And it has had a huge impact on, I think, the entire state, but definitely on communities within the Twin Cities area. And that's put a huge challenge and really a demand on our mental health providers. And I was also our educators as well when it comes to serving community, because now they have this heightened kind of cultural awareness piece happening as well. Have you noticed any shifts in your therapy or just with the families or individuals that you're working with? Are they bringing issues of race or racism into their sessions? Like, how are they processing all that's taken place since George Floyd?
I think it's a lot of awareness about difference, especially working with kids that are in the school system. I've had to have a lot of conversations with families that haven't been given the resources that they need to make sure that their kids are successful. I've had to work with, you know, kids that have been suspended and kicked out of schools that nobody ever talked to the family about getting them on an IEP or a 504 plan. And so I think the way that, for me in particular, how it comes into the space is kind of finding that community for families of color of, you know, like, what are your resources? What can you access? Because a lot of times it's really being able to navigate the system because the system is set up against them to begin with. And so as a provider who has a lot of access to resources, I think it's important for families to get that information and to walk alongside them in that process. I feel like too often we leave our families to their own vices of like, I gave you the resources, you know, why didn't you reach out and use them? And sometimes it's just taking those extra steps of being like, hey, do you want to make this call in session? Or what questions do you have? Do you want to make those together? I think really goes a long way with some of these families. And I think it also builds that trust that other systems have broken.
Do you ever notice yourself integrating any like cultural awareness or cultural sensitivity into your practice, no matter what the ethnic background is with your clients? Like, how does culture show up when you're engaging with your clients?
It typically shows up, I would say, even from doing the assessment. We have a question where I ask about people's cultural background and identity, and I get so many weird looks when I ask it. But I really approach it from a lens of like, what makes you you and who are you? And so really just starting from that lens of, I'm not just asking about your race or like your culture. I'm asking about like your values, your traditions, like the entire makeup of who you are. And I think that's relatively different to how we typically do assessments, because it's just a quick question about like, okay, is there anything important we need to know about your culture? And most people say no. But I always like to get curious with my clients too about, how do they think that their identity is impacted by the world around them? So kind of exploring like, what do those relationships look like with other people? What does it look like in those different systems working with primarily white providers? And so again, I think it becomes more of like an advocate role in my shoes, because I have the privilege of having some of the background knowledge, knowing how to interact with other professionals and make sure that the families get what they need.
Absolutely. Now, on the flip side of that, do you ever notice, or has this happened where your clients are kind of questioning your ethnicity? Like, who are you? Like, what are you? Do they ever ask you questions about your own background?
I think I usually get it more so from kids, just from like a curiosity lens. I know I am pretty light skinned, but I feel like most of the time when I interact with African American families, they know that I'm mixed with something. So for the parents in particular, I feel like I'm easily identified, but the kids usually get curious about like, okay, what's your makeup? I know that you're not white. So what are you? And I think it is a great conversation to have with the kids. And I've even worked with a client who is also biracial, and I think it's really helped with their identity development. I tell this story because I think it's really funny, but the kiddo was struggling with their hair because they had really kinky curly hair. And after working with them for a little bit of time, they actually started to adopt similar hairstyles as me. And so it was just kind of fun to kind of see that comfort level kind of change, because they would always come in with like bone straight hair, and caregivers were really concerned about the integrity of their hair because they are doing these harsh things to it. And so it was kind of cool to see that transition of that like acceptance and embracing their hair type. So I thought that was pretty cool.
Yeah, I think that's one of the the elements that gets overlooked when you have providers of color, where our clients oftentimes identify themselves with us. And it's interesting because when you go to school for therapy, you're taught not to have that. Like you don't want that counter transference or that transference to take place. But there's a cultural factor that helps in that dynamic. And I think that kind of goes back to what you were saying earlier of, most of the therapeutic work we do comes from a white male perspective. And a lot of those perspectives are over 100 years old. So think about how much culture has changed and how much we know now about healing and doing therapeutic work. There needs to be, and this is my bias, but there needs to be some more updated and built on those old frameworks and those theories to meet more of the modern day demands that we at least have here in the United States. Because I'm not saying that we should just scrap them. I think that we have had some amazing discoveries through works of many different therapists and psychologists. But we definitely need to have the 2.0, 3.0, 4.0 versions of these things and not just take it as the only gold standard that's out there. Because it does happen. And it leads to one of my next questions around intersectionality. You being, a mixed race woman and having, a mixed race client who identifies with hairstyles and they find a piece of their identity with you. I've had a dynamics like that myself when I was a therapist, when I was doing more clinical work. But I'm a Black male. There's no getting around that. Like you just see I'm Black. But what ended up happening is a lot of my clients, especially my Black male clients, they would start to identify me not as their therapist, but like an older brother or an uncle, and even sometimes like a father figure, which makes it very difficult. But to have that Black male camaraderie and that respect and that identity and that bond is a very important element within African American culture. And I would see a lot of the Black males do that. And not just like the littles, I'm talking about like the 24 or 25-year-olds. They're like, hey man, like when you're off work, you want to go watch the game? Like, I'm like, no, I can't do stuff like that. But they felt so connected and compelled. And that's a key thing. but there's restrictions in our field that we can't really go across those, but we shouldn't go across those boundaries because some people probably still do. But that brings up the element of intersectionality. And how have you addressed the intersectionality of identities in your therapy? Being a woman, various different levels of sexuality, ethnicity. Like, how has it shown up in your sessions with your clients?
I think I tend to approach it from a lens of like, I will recognize I will always have bias in some areas. That's inherent to all humans. But I really try to approach every client that walks into my room, into my space, with that like sense of neutrality. And often the questions I ask are around like feasibility for my particular client. Because I feel like so often, we throw out things like doing self-care, and that has been a buzzword that has been created. And people associate that with like taking bubble baths, going to get massages, all of this sort of stuff. And in reality, that may not be accessible to certain people. And so I typically ask folks, like, what do you have access to? What is available to you within what you have to work with? And so I think that also helps a lot of clients understand that I'm not going to put these impossible tasks before them. And I'm actually seeing them as a whole of like, I see you in your circumstance, and I'm not just comparing you to this like standard. And so I think that's really helpful, or even just bringing that awareness into the room of like race and culture and things like that, of like, I know that I will never experience what you've experienced in your life. And I may have some points of comparison, whether it's from my own life, whether it's from others that I've worked with. And at the end of the day, like, I want to hear their story and their experience.
Mm-hmm. Yeah. I think that's one of the ways that we definitely can make a community impact, is by not being afraid to address the systematic issues that pop up when our clients bring them into the room, whether they're aware of them or not, but being willing to go there. And I talked to a lot of therapists over the years who are afraid to touch discrimination. They're afraid to even talk about intergenerational trauma or racism. They don't want to bring those things. They want to just play it, surface. Let's just talk about your depression, but there may be some system things that are happening that are influencing how the client or the family dynamic is going. Can you share a few strategies or techniques that you found to be effective when supporting your BIPOC clients on their healing journey, or just empowering them to advocate for their own mental health needs?
Ooh. I feel like that's kind of a tough one, because I can't say that I have any particular interventions. I feel like most of the time it's really more of that process. So if there are a lot of like resources that the family needs access to, or they're really struggling on like what questions to ask different professionals, I think it's more of that, like walking alongside them during that process. And so, for example, like I have a lot of BIPOC clients that really struggle with like their medication management. And so we often talk about like, what questions can you ask your doctor? Do you want me to consult with your doctor and kind of talk to them about what's going on? So again, that ability to collaborate with my client on like, how do we get your needs met? Because again, I think about that hierarchy, and again, my place of privilege of like knowing some of these systems better than my clients do, and being able to advocate for them in those spaces. And I think also just like that acknowledgement of like, unfortunately, our system does suck, and it's built on white supremacy and all of the isms. And so, we never want to dismiss that, and we can kind of sit in that. And how do you as an individual want to move forward and live the best possible life that you want to live, even in the midst of all of this really icky stuff. And I know sometimes that's really hard for clients to like sit in that duality. And I've seen it do wonders when folks can get there of like, all right, like I can hold this, but then also figure out like how I want to build my life and move forward.
Mm-hmm. Absolutely. Absolutely. Let's talk a little bit about the field in general. Let's talk about your experience now. You've been, in the field for about 6 years or so. Are there any improvements or things that you think this mental health field should really start to consider to look at more or to readjust in order to better help, clients of color or even professionals in this space of color or BIPOC folks? What are you noticing? What are you seeing in this field of work?
Well, first and foremost, we have a lot of work still to do. Mm-hmm. But I really do think it's about, how we teach up and coming providers of, we have all of our textbooks and our baseline information, but how are we incorporating culture? How are we incorporating lived experience? And not just like your one-off culture class that you take for your master's degree, but like how do you integrate it into every step of your learning? And how do you start to explore more of that research of like what interventions do work for different populations, or what are some of those historical experiences that may deter people from seeking out services? And so being able to address those, being able to bridge those gaps, I think are really important to grow our field and ultimately bring a bigger variety of individuals into the field, both providers and clients. Because it really does come down to a lot of times, like who sits across from you. I've had many families literally say the only reason we came to therapy is because you are a Black woman. Mm-hmm. And so like, I think that's really powerful. And I don't think that's where we stop, because right now our field is predominantly white. And mm-hmm. I don't know that that'll change in quite some time. But I think if white providers are able to show more of that cultural competence and cultural humility, I think more folks of color will be more comfortable meeting with a white provider. Ultimate goal would be able to have more providers of color so folks have more availability to choose. But kind of in the meantime, being able to grow your competence. And I think that also goes with that ability to be vulnerable and to say, like, I don't know what I don't know. And that ability to have those conversations with people that have different types of lived experiences, different backgrounds, and being okay when people say openly, like, I don't want to teach you, but here are resources that I can give you.
Absolutely. Absolutely. I know a little bit about you and some of the work that you do, and I want to ask you a question about somatic work, because I wonder if that plays a role in some of these dynamics at all. Can you tell the audience what the somatic work is, and if you do think that it helps in some of this healing process for BIPOC folks?
Absolutely. So I will say I'm still pretty early in my journey in somatic work. I did take a training for integrative somatic work specifically within trauma. And for me specifically, having worked in the field for about 6 years, I've come to realize that we can talk all we want about trauma and about experiences, and we can problem solve to an extent, but as we know, research shows trauma lives in the body. And I do think for a lot of BIPOC individuals, that's how they experience without having the words. And so the ability for our field to grow in that somatic way would be so helpful, because maybe if somebody doesn't have the words, they can tap into what's happening in their body. And with what I've learned is, like, once we kind of get through that body sensation, a lot of times people feel a lot more relief than if they were to spend 6 months in a therapy room just talking to someone. And so there's just a lot of research out there that says somatic work is so healing. And unfortunately, I think it's probably some of the hardest work you can do, because most people are so disconnected from their body that kind of going inside is really scary. And so, it really starts off with some of those basics like deep breathing or even like meditation. So just being able to have that awareness of your body to begin with will help you start to understand like how your body reacts to certain things. For an example, I worked with a client where we actually went through my grandmother's hands together, and we read it together and did some of the practices together. And it was really interesting. They were talking about one of the practices, and they were like, I utilized an instance where I hurt my knee. And when I was going through this somatic practice, I could actually feel that in my knee, and I was never aware of that. And so just kind of that power of that awareness and being able to kind of focus and move through some of those sensations, I think are so important, to be able to feel more in control in our bodies and start to kind of calm our nervous systems, which we know for BIPOC folks, we're already up here at a baseline because of all of the historical trauma, systemic trauma, all of the stuff that just encompasses being a person of color.
Wow. Yeah, it's so important to realign with the body. I think one of the one of the strategies, I try to avoid solutions because when it comes to mental health, I don't think there are solutions. I think there's just like strategies. Like you have to figure out like techniques, coping, and you process. It's more of a journey than a destination as we go forward. But one of the strategies that I think is going to help, I should say communities, I'm not gonna say society, would be that people have to just take general better care of themselves as far as well-being. And relying just on professionals, I think, is going to set us up a bit. I think during the pandemic, many people said, I need to talk to a mental health professional, which is great, but there's not enough. We don't have enough mental health professionals. And those professionals have their own mental well-being that they have to take care of as well. I think in general, people just picking up healthy habits and engaging in things that bring joy and bring progress to their life is going to help a lot of what we have going on. Because there's a lot of work, like you said earlier, there's a lot of work for us to do for sure. All right, this is my last question for you. This is pretty much our wrap-up question. Is there anything that you would like to share with our audience about your journey as a BIPOC mental health provider or your perspective on the importance of cultural competent therapy?
Ooh, big question to end.
Final thoughts.
I would say, like you had mentioned, like all of being a therapist, being a client, it's definitely a journey. And I don't think it ever stops, especially as a provider of color. I'm still learning a lot about the various identities that I don't have, let alone still exploring my own identity to help support clients that have similar experiences or do look like me. And so I definitely say for aspiring therapists, especially providers of color, to really dive into that self-work along with learning how to work with your clients. Because I think some of the biggest things that we can do for our clients is model some of those skills that we're teaching them. Because if they can see that it actually works, I feel like that instills some hope that they can get there too. Again, even though at the end of the day, we know there's still some gray things that are going on, but to see somebody that not only looks like them, but is doing the work along with teaching the work and seeing that success is really important. So yeah, I think that's what I have.
Well, that's great. Where can people find you? Do you have any social media handles or anything that you'd like to share?
So I am on LinkedIn. If you just look me up by name, I don't have any other current social media, but I do currently work for Fernbrook Family Center. So I am on their website, and folks can reach out to me from there. I'm always happy to talk about all things mental health. So would love for people to reach out just to have conversations or to bounce ideas off of.
Awesome. Thank you for joining us, Jade. It was a pleasure talking to you today on the podcast, and we look forward to maybe hearing from you again later on in the future. Take care.
Thank you so much.